our paper was looking at the literature, the published literature on whether what factors are associated with uptake of hormone replacement therapy in the population. We identified 53 papers in the systematic review, and as part of that, I identified some factors which are associated with higher uptake of hormone replacement therapy. We found that women of white ethnicity were more likely to be taking hormone replacement therapy compared to, and I'm going to call it HRT from now on, compared to women of other ethnic groups and of Black ethnicity. We also found that some comorbidities or health conditions that people are living with may mean they're more or less likely to be taking HRT. We suspect there may be some cautious prescribing going on here because obesity and diabetes are risk factors for cardiovascular disease and more serious other health conditions. So the clinician may be cautious in that, but we think that everything, as you say, needs to be individualized. They should be looking at their individual risk and whether there's a different and more appropriate way of prescribing. So, for example, if a woman is given transdermal or patches HRT, the risk of cardiovascular disease may be better. It's likely to be both, that that clinicians are possibly looking at the woman's own health history or family history of something like osteoporosis, and recommending HRT for them to protect their bones. But there may be also be other factors because we have found that hormone replacement therapy is associated with higher socioeconomic status. So women who are taking hormone replacement therapy are more likely to be from more affluent areas, and along with that, there's often higher engagement with healthcare services generally, and their health literacy may be higher, so their understanding of their symptoms and an ability to articulate that in a way to their GP. So it could be both of that going on. But again, going back to looking at the individual risks and benefits need to be explained to each woman because HRT might not be the right solution for everybody. We were limited in this review by trying to find an outcome which we could combine across all the different studies. So we were not able to look at duration of use, and that's a really important question because if somebody's suffering from quite severe symptoms, they may feel that they need something to alleviate that. And for them, it may be okay to take HRT for a couple of years, but they may want to stop after that and not continue for 10 years. And we weren't able to look at that in this study. So this is a limitation of the work of how long women using HRT is something that we still need to know a bit more about. And also the different types of HRT they may be taking. Again, we weren't able to pick that apart in this review.